morning, teacher. My name is Maythe Flores. Class project. Learning is a truth that we follow it is owned everywhere. The role of the respiratory physiotherapy in times of COVID-19. In this time, COVID-19 has impacted worldwide, generating a health emergency in the vast majority of infected countries, associated with a high mortality rate. On March 10, 2020, the OMS declared COVID-19 a global pandemic since the physiotherapy resolved around the moving of the human body from the fundamental and complex, such as the moving of gas in the lungs and a liver, space to generation of very elaborate movements, in addition to the conveyance and handling of biomedical equipment such as mechanical ventilation. Overall objectives: conduct the role of the respiratory physiotherapy in time of COVID-19 and their intervention to contribute in the eradication of the virus. Specific objectives: conduct the visual security state for the prevention of COVID-19. Discuss the importance of staying home during the pandemic. The role of the respiratory physiotherapy in the management of the COVID-19. The role of the respiratory physiotherapists is based on physiotherapeutic strategies of care for this population, starting from the detection and diagnosis with the taking of respiratory sample from both the upper and lower respiratory tract and implementing a series of physiotherapeutic strategies and a special of the optimization and prevention of the deterioration of pulmonary function and kinetics in the two diagnostic patients. In addition, the respiratory physiotherapist acts in the surveillance process against the early recognition of respiratory failure, acting in a timely manner in detection of cases that require security diet airway with interdisciplinary monitoring in the invasive intubation progress, that is, voluntary strategies, monitoring and relies on veterinary mechanical support and, of course, in the prevention of the early vigilance program. Biosecurity protocol for the prevention of COVID-19 that shows anything of the roads. You should wash your hands. You should not greet with the kids. You should not leave the house if not necessary. Use a mask and alcohol. The importance of staying at home during the pandemic. Staying home during the pandemic is very important to prevent the spread of COVID-19. If you don't leave the house, you can get infected. Conclusion: I can conclude that the intervention of the respiratory physiotherapy in the management of patients with COVID-19 it is of great importance since they can reduce the septum, maintain lungs capacity, and prevent most loss. Recommendation: stay at home to avoid the spread of COVID-19. Leave trips to the supermarket when absolutely necessary. Wash your hands all the time. Use a mask and alcohol. Thank you.